Hello, everyone. It's a pleasure to be here with you. Thank you so much to Quintessence Brazil for the invitation to be here. Also, of course, thank you, Dr. Renato Hassi, my great friend for many years, a colleague, a friend, a co-surgeon, and the co-author of this book. This is in English. Of course, it's available to you in Portuguese, is in Brazil. I'm going to cover a very small portion of this book in the presentation today, maybe about 5% of it only, and something so easy and straightforward that everyone in the audience can implement into your office, into your practice very easily with little to no cost and great benefit to your patients. Dr. Hassi will also be presenting at this Congress. He's going to go in a bit more detail and cover another 5 or 10% of the book. And then, of course, you've got many, many other speakers that will give you even more information similar and related to the topics that we're talking about. I put here on the slide that many people say that beauty is the passport to success. And many times it is. But I sort of joke, it's more like a visa because it expires with age. And that's what happens to all of us, is due to the normal aging process. And that happens, time marches on. We can slow things down if we take care of our skin and use sunscreen and moisturizer, of course, and limit is nicotine and limit caffeine and try to get enough rest, is we can slow it down. But even by slowing it down, it will slow it down, but doesn't prevent it completely. And then we can look to surgical procedures or non-surgical procedures as well to slow things down further. And that's what we'll talk about today, is non-surgical procedures to slow things down. Of course, we still want to eat right. We still want to take our vitamins. We still want to use sunscreen. We still want to get enough rest. But what happens is these procedures can help slow things down more. This is a Brigitte Bardot. She was a model in maybe the 60s or 70s. And she's decided she's not going to do surgical or non-surgical procedures, simply is live a normal, healthy lifestyle. And this is how she looks today. And that's fine. That's great. And that's to be commended. On the other hand, this is Sophia Loren, also a model about the same era as Brigitte Bardot. And she is doing procedures, both surgical and non-surgical. And this is how she looks today. And that's great. And that's a personal choice. And both choices are great. What we're here to talk about is those patients of ours that make the choice to get procedures done, how we can do it for them and how we can do it effectively for them and to maximum benefit for them. And what's happened is in the past, most of these procedures were surgical. And so plastic surgery boomed. And what's happened is over time, the number of procedures that are surgical has decreased. Plastic surgery is still booming. But what's happening is more and more of it is becoming non-surgical procedures. And the growth in non-surgical procedures has exploded, or let's say minimally surgical. And that's things like fillers, or Botox, or lasers, or chemical peels. And there's so many different procedures, as you can see here on the slide. And we certainly can't in an hour cover all of them at all. Well, we're going to focus on just one small bit of it, this portion here, microneedling, and of course nutrition, but microneedling, something very, very easy, something that everyone in the office can implement into your practices easily and effectively, and where the patients see tremendous benefit immediately is from it. What happens is by age 50, our skin begins to thin out and the dermis becomes thinner and thinner and thinner. And at the same time, the collagen within starts to decrease. So whereas we might have had collagen before, as I get older, this collagen is gone. I might have had collagen here, but as we're older, this is gone. So I have developed a groove, whereas in the past it was flat. Collagen that used to be here is gone, so I developed an indentation here. Collagen that used to be here and support up my lips is gone, and now it looks like I'm frowning all the time. And so the skin is getting thinner and the collagen is being lost. And the skin consists of what's known as the epidermis, the outer layer, and that's purpose is to keep things out. If I touch a doorknob, I touch something. So all the bacteria on that doorknob don't enter my bloodstream. So the epidermis is designed to keep out things as small as bacteria. It's designed to keep out things as small as viruses. If someone sneezes on your skin, it doesn't get you contaminated. They have a cold or a flu or COVID on your skin, it doesn't contaminate you because this epidermis can keep out things even as small as bacteria and viruses. Beneath that is what's known as the dermis. The dermis gives support to that epidermis. The dermis is lots of viable cells. That's where the collagen is. That's where the keratinocytes that produce the keratin and give a nice smooth finish to the skin are. The fibroblasts that make up the collagen are there. And the melanocytes, the ones that give the skin our color, are all located here. And then beneath that is the hypodermis. That's where the fat and the blood vessels and such is there. And we can do this by using microneedling. We can use the body's own healing abilities. If you take the patient's own blood and spin it in a test tube, the red blood cells will migrate to the bottom, and that's about half the volume. As you see here, about 41%, although it varies from patient to patient. The middle layer is the good stuff. The middle layer is the fibrin. The middle layer is the white blood cells. The middle layer is the platelets. And really the maximum benefit here is the platelets, because they have within them growth factors that tell your body to reform the collagen that has now been missing. It stimulates collagen formation in this application. And in other applications, that middle layer will actually help form bone or form soft tissue, depending on where it's placed. But when that middle layer is placed in skin, it helps to form more and better skin, more and better collagen there. And the top is simply serum. That's just so if it wasn't there, this would be so thick. So the serum, or what's called plasma, is also about 50%. And that's just to keep it flowable so it doesn't get too thick. So we're interested in this middle layer, and most of you are familiar with it. We call it PRP, platelet-rich plasma. Some people call it PRF, or APRF, or IPRF, or a variety of different names. But the bottom line isn't whatever name you give it, it's that middle layer. That top layer is the serum or plasma. We don't use that. That's the platelet poor plasma. We're going to use that middle, the golden layer here, right in the middle. And then the bottom is the red blood cells. So as you can see, that middle golden layer is about 5 or 10% of the volume of the test tube. That's where the platelets are located. That's where the best healing capacity is located. That's what we're going to use. And what happens is when we use these things from the body itself, is they actually help stimulate. They actually is from the body themselves. There's nothing foreign. But the other nice side benefit is the cost. That's not the driving factor. I'm not doing it to save on cost on my patients, and neither are you. But the interesting thing is when I make it from the body, is the things that I'm using are $2 to $3 per patient. Instead of when I purchase Restylane or Juvederm, which might be $600, $800, $1,000, depending on how much of it you use, simply to purchase the product in those cases. So we're going to draw the blood with anticoagulant in it so that it doesn't clot. So it's going to be liquid. We'll draw this top portion. For microneedling, we're not going to use the top portion. We're going to use that golden layer, that middle layer, so that we can place things into the skin. And by placing things, what I mean is, as I said, the epidermis is designed to keep things out. Whether it's a cold virus or is infections, it's designed to keep it out. So we go to the pharmacy, we get lotions and potions to put on our face, and they actually don't soak into the skin. And that's why there's such limited benefit from the things that we buy at the pharmacy or the drugstore to put on our face. One of the biggest benefits is it provides a barrier to prevent moisture from leaking out. So there is that benefit from the things we purchase, but very little of it actually makes it in. If we take what's known as microneedling, this device, as you can see here, has numerous needles on it. We'll talk about the size of the needle. And if we roll it across the skin, after we've placed topical anesthesia, of course, now we've created micropunctures through the epidermis into the dermis. Now, if we take these things, this golden layer, and smear that on the patient's face, we're able to get these growth factors down to the dermal layer in thousands of these micropunctures. The other benefit is whenever there's a small hole, the body tries to heal it. And as it heals it, it shrinks things. So it tightens the skin. So we're able to get things down into the dermis. And number two, the simple healing process of thousands of holes will help tighten the skin. Now, I mentioned the top portion. The top portion could be used in a different way. The top portion, it's liquid now. If it's heated, it will turn thick. And when it turns thick, it can be used as an actual filler. And so Dr. Hasse will talk about that. I'll talk about the microneedling is portion. The concept of PRP is Robert Marks and I developed at the University of Miami numerous years ago. And we published his first book on it through Quintessence Publishing, Dental and Craniofacial Applications of Platelet-Rich Plasma. We talk about the biology, the development of platelets. It's used for bone grafting in office techniques. It's used for soft tissue regeneration in office. It's used for tumor and trauma defects. And it's used for facial cosmetics and plastic surgery, and an appendix for phlebotomy about this. And then what happened is, once we developed this whole concept of PRP, then folks came up with different nomenclature, PRF and CGF and a variety of different things. And so most recently, I changed the name to autologous blood concentrates. And this book then came out 3 years ago in 2018. And most recently what's come out is a second edition of autologous blood concentrates. So this was the original textbook on it. This one came out a few years ago. And this newest textbook, also from Quintessence, all three of them, is now taking the science that we had very heavy in here, all the clinical applications we had heavy here, as well as recipes for making the 7 different configurations of PRP and PRF that are available to us today as clinicians. And then what's exciting is the most recent textbook that we have out. This one, Dermal Fillers for the Dental Professional, also from Quintessence Publishing, in English here, but also available in Portuguese in Brazil. And here we're showing microneedling, of course, the biology of doing these procedures, and then how to inject the fillers in the various areas, how to inject it, how to get anesthesia there, and even how to do it with PRP and heating it. So the 2 textbooks I would recommend is the Dermal Fillers, and the second edition, Autologous Blood Concentrates. So if we're going to treat the patient, we get some photographs. All of you know this is from the side, 45-degree angle, the front, other 45-degree angle, and the other side. And then what I do with these pictures is I show patients things like this. And I say, I have a gradation system. And I show them where they are. Look, I think you fall here or here or here. And I let them know there's no way I can get you from 6 to 1 with non-surgical procedures. And even with surgical procedures, I can't get you from 6 to 1, but certainly not with non-surgical. With non-surgical procedures, I can get you from 6 to maybe 5.5. Right? With surgical procedures, I can get you from 6 to maybe 4. So I tell them with surgical procedures, I can get you maybe 2 notches lower. With non-surgical, about half lower, from 5 to about 4.5. Right? So that way, they have reasonable expectations. With non-surgical, we can take this and we can fill this in to get it this smooth, but of course not like this. So then they can see afterwards, yes, they're able to get this. All right. I also, of course, use a consent form and get that filled out. And then what I'm going to do is I like to use the blood because it's the patient's own. It works as well as these commercial products, but in addition to actually helping fill and actually bring moisture to the area, like the hyaluronic acid would, it actually helps stimulate the body's own collagen formation. So it takes care of the underlying problem, not simply masking the underlying problem or covering up the underlying problem. So I prefer to use PRP whenever possible. And I'm going to use topical. I make a compounded topical using a mix of benzocaine, tetracaine, lidocaine in a creamy base. And so we apply it on the patient's face, leave it on for 20 to 30 minutes. Less than 20 minutes, it doesn't penetrate in the skin. It's not like the oral mucosa where you place the topical and it absorbs within 30 seconds, maybe 1 minute, right? The oral mucosa, the nose, they're designed to absorb things. They absorb food, they absorb oxygen, they absorb bacteria and viruses. That's why we wear masks on the nose and mouth, because that's where we can catch the COVID or the flu, etc. And so the skin is impervious, so it is not 2 minutes, it's 20 to 30 minutes for the anesthesia to take effect is here. And in that 20, 30 minutes, it will eventually get down into these layers. And if it eventually gets down into the dermal layer, I'm able to microneedle down to that dermal layer. I'm able to get the needle down in there. And how deep is that layer? That's about 1 millimeter deep. So that will soak in that anesthesia about 1 millimeter. And then what I'm going to do is I'm going to apply the anesthesia. It's going to go in that 1 millimeter. The needle will go in 1 millimeter. So the patient shouldn't feel is discomfort from it. And the cells out of there, the keratinocytes, they're the major ones. They're the ones that give the skin the keratin and the smooth texture. And the other cells that I mentioned to you also are there. Is the collagen forming cells are there. Also, the melanin, the skin color forming cells are there. They're all in that second layer. Now, we all know what healthy skin is. The most healthy skin would be a newborn. Babies have and it's even. There's no discolorations. There's no splotches. And so that's what we're shooting for is the end goal. It's tight, it's thick, it bounces back evenly. So if that's the idea we're shooting for, how can we get to that? And what happens is the body tries to, of course, always heal itself. You extract the tooth, the gum heals up. You make a cut on your finger, the skin heals up. Right? And what happens is you go to the gymnasium. Your muscles come back stronger. Right? Is if you overstress yourself, then you will actually get an injury to your joints. So small trauma is good. Go to the gym, small trauma, it's good. Too much trauma would not be good. Right? So the microneedling is small trauma to the skin. Small holes that will heal up tighter. Small holes will actually improve things. Large holes and cuts would not. Large holes would be a problem. So that's what's microneedling, not needling, but microneedling, very, very small, fine needles. Right? And what that will do is help tighten things, but will help actually stimulate something better. It's like going to the gym. You go to the gym, you do your exercise, your muscles come back stronger than they were before. Right? So what happens is when that trauma occurs with microneedling, down to the dermis, those cells in the dermis, the keratinocytes, they get a message, hey, there's trauma. We got to come back bigger and better and stronger. The fibroblasts get the message, hey, there's trauma. We got to come back bigger and better and stronger. The melanocytes, they get the message. They come back and they're going to come back more even. And these cells also communicate with each other. So it is not simply the trauma. The keratinocytes are then telling the fibroblasts, hey, you need to do your part. I'm going to do my part and make even skin. You need to give more collagen. And both of them then communicate with the melanocytes that, hey, we're making new skin, smoother skin, better skin. You need to make it more even coloration. So the cells are not just responding to the trauma, they're communicating with each other. And so don't underestimate the ability of the skin to heal itself with that micro trauma. Those messages, just like going to the gymnasium, right? A correct amount of trauma at that gymnasium helps the muscles grow better. A correct amount of microneedling helps the skin come back much better and smoother. And the cells definitely speak to each other. So yes, the skin is designed to keep things out. That's why we need thousands of these holes in there so we can allow things in. So the needling itself sends a message for the collagen and the keratin and the melanin to do a better job. But since we've got the holes, we can put things in there that will take that function to the next level, that will then allow the cells to communicate even better. We allow in the PRP, the concentrated platelets, which have the growth factors in them. And by putting those growth factors in, it makes it even easier for the keratinocytes to communicate with the melanocytes and the fibroblasts, and stimulates the fibroblasts to create more collagen in the area. And so these are three cell types that are communicating with each other. So what microneedling is it takes maybe 15 minutes, maybe up to 45 minutes, right? But very, very short period of time, it eliminates lines and wrinkles in the face or minimizes them half notch over in my scale of 1 to 6. decreases sun damage, decreases looseness of the skin because it tightens it up. If there's stretch marks, is tightens those up. Acne scars, minimizes those. Is if there's large pores, decreases size of that. If there's age spots and discolorations, evens those out. So what I'm going to do with that roller is not go back and forth, back and forth, back and forth, because that just goes back in the same hole over and over and over. It doesn't create more holes. It just creates more pain. So what I'm going to do is go one time only, not back and forth, one time. And then after I've done that, I'll go one time vertically. And after I've done that, I'll go one time diagonally. So one time horizontal, one time vertical, one time diagonal in each area. That's what we're going to do. All right. So if we go through the steps of this, we apply the topical anesthesia. All right. And once we've applied the topical anesthesia to the patient's face, we're going to let that sit for 20 to 30 minutes. All right. And then we're going to draw the blood. All right. That may take 2 or 3 or 4 minutes. All right. We'll put in a centrifuge. That may be 10 or 12 or 14 minutes. So meanwhile, the 20 minutes of anesthesia, this is now up to maybe 12, 13, 14 minutes, the spin. Now we take it out. It's separated, the yellow layer at the top, the serum, the golden layer, the layer we're interested in, right, that has the platelets in it, and the red blood cells at the bottom. We draw up the top part. Either we heat it so that we can use it as a filler, or we discard it. Then we take that middle layer that we're going to use for the microneedling. All right. So now we've got our PRP ready. Now the patient is ready. They've had the anesthesia on for the 20 to 30 minutes. The timing is very similar. And who's doing all of this in the office, of course, is the assistant. She's drawn the blood. She's spun it. She's put the topical anesthesia on. So you and I, as the doctor, can walk in and now we'll wipe the anesthesia off. It doesn't have to be taken off with alcohol, just with normal gauze. If you leave a little bit on, that's fine. But we're going to take off the bulk of it. Okay. Doesn't have to be absolutely dry. Once we've taken off the bulk of this anesthesia, we wrap the hair in a headband. All right. And now we're going to take our needle device. Now, there's a number of different needling devices, and you probably will see a lot of them exhibited at this convention. Some of them, as you saw, are rollers, and they're just done by hand. That's the least expensive, but the least effective because you can't control the depth on them. Some are pens, which are electric control, where you can control the depth on them, right? But you can't inject things with them. Some are rollers like this one, where you can put a cartridge in the back, a cartridge of PRP in the back. And what this is doing is 3 separate things at one time. It is turning the roller and doing the needles, is providing a suction, so lifting up the skin, so the needle is sure to penetrate and at correct depth. And at the same time, spreading the PRP in that area so that it goes into the holes that were created. So suction to suck it up, correct needle to go the proper depth, and PRP being spread all at the same time. So whichever one of those devices you get, all of them work. They just go from most basic to the most sophisticated. And now it's just simply a matter of going, as we said, horizontal, 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 then vertical, 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 then diagonal, diagonal, diagonal. All right. About 15 to 45 minutes for the procedure. All right. They will see benefits after just one treatment. If they do another treatment 2 weeks later, do they see more benefits? Yes, they do. If they do a third treatment 2 weeks after that, do they see more benefit? Yes, they do. Up to about 6 treatments. After 6 treatments, the amount of benefit becomes negligible. So the first treatment, they get the maximum benefit. Second treatment, a little benefit. Third treatment, a little bit. Fourth, a little bit less. So with each subsequent one, they get less and less and less. So the first one is the most important. If they get just one treatment, it works. It will work great for them. If they get 2, even better. 3, even better. And up to 6. More than 6 is not going to help them. And then I tell them that you should come in and get a touch-up about every 6 to 12 months after that. And 6 to 12 months after that doesn't have to be another round of 6 treatments, just one treatment as a touch-up every 6 to 12 months after that. All right. And this is it. This is something that all of you can do, easily implement into your practice. And you can go from the most basic rollers to the most sophisticated, keeping the cost minimal up to is a reasonable cost. And so it just depends on what kind of cost you want. And then if I have extra PRP left, then what I'll do is actually smear the excess on. Why waste it? Why throw it out? That golden layer, I'll take that, put it on there because the porosity has been created. The holes have been created with the microneedle. I'll spread as even more of this, another layer of this. Those holes will close up. They'll close up within about 1 hour. So after that, things are not going to get into the patient. You say, well, are colds or flus or viruses going to get in there, bacteria? No, after 1 hour, it does close up. Right? Nevertheless, I don't want them putting on sunscreen an hour later or putting on is makeup an hour later. I prefer they wait until the following day is to put on makeup, to put on sunscreen for a day, just to be sure absolutely that nothing gets in there. All right. So this is spreading the excess. All right? And we'll go through a second quick case of this and we'll wrap up. Put the topical on. I'm not showing you that picture. We put the topical on while we're waiting for the topical to take. Draw the blood, spin it, get the layers. Okay, it's spun. The topical has taken effect. We'll wipe off the excess. All right, and once we wipe off the excess, wrap the head. Okay, this is the device I'm using, but there's many devices out there and different types. Is this one has a cartridge for the PRP here, suction to lift up the skin, the roller to puncture an exact depth. And so we're going one time all over the face horizontal, one time all over the face vertical, one time all over the face diagonal. All right. And then is the device was actually in this case, putting and injecting is in flushing the area with the PRP. But then if I have PRP left over, which I usually do, then I'm going to actually take whatever else I can and spread more of it. You can see I'm spreading more of it. Okay, this is a before, immediately after. It's going to tighten up in 24 hours, and they will actually see that glow within 24 hours to 72 hours later. And it will keep on getting better. And then, as I said, if they get another treatment 2 weeks later, even better, they'll see is a more benefit. All right, so apply topicals, 20 minutes, right, is at the same time. Once we've done that, draw the blood, takes a few minutes, spin it, takes about 10 minutes. Is remove is the topical, separate it, etc. So the two things are occurring simultaneously. And if I took that top layer and heated it as a filler, then after we do the microneedling, we would do our filler injections afterwards. Right? And I'll leave that for other speakers to talk to you about fillers. All right. So the workflow is remove most of the topical, dermal roll, smear the PRP. And then if you're going to inject in the heated PRP or Juvederm or Restylane or the commercial fillers is whatever you're going to use. Okay, so thank you. This was the amount of time that was allotted to me. Thank you again to organizers. Thank you to all of you participants for participating in this. And thank you once again to Dr. Hassi for participating and being my good friend and colleague for so many years. If you have any questions, I'll be available in real time to answer those questions for you. Okay, thank you.